Shubha Madhyana, everybody. So I welcome you all to the session 9 on Shalya Tantra, that is the Bhagna-Sessions. Today, before we start the session, we will start it with a prayer. Om Namami Dhanvantarim Adidevam Sura Surair Vandita Pada Padmam Loke Jararubhaya मृत्युनाशं दातारमीशं विविधौषधीनाम्. Okay, good afternoon again. I once again welcome you all to session 9 of Shalya Tantra on Tadvidya Sambhasha Parishat page. Okay, until now we have completed 8 sessions on the topic of Bhagna. We also have covered the the chapter of Bhagna from the Nidana Sthana of the Sushruta Samhita, and we have also seen almost in a little bit detail of starting from the anatomy till the various types of fractures. So I think today could be the last session. It would be suffice for us to come to an end with the sessions of Bhagna. So today we will be dealing with the Bhagna Chikitsa from the Sushruta Samhita. So all of you who have Sushruta Samhita with you, today we'll be reading through the Sushruta Samhita. So you can keep them in front of you. And with that, we will just briefly see a definitive treatment protocol for the fracture according to the modern. Now we have seen the basic fractures with respect to specific type of fracture, right? Whether it is fracture of the humerus or the femur, we have seen the definite treatment. But suppose in case of any kinds of fracture or dislocation, right from the scene of the place wherein the event has occurred till the rehabilitation, what should be the flow chart? We will just see in a small brief note. So before that, now we will start reading through the main important shlokas of the Chikitsa aspect of the Bhagna from the Sushruta Samhita. So today, okay, so we are taking it from the Sushruta Samhita. We have the Chikitsa Sthana, the 3rd chapter. Okay, so now we will start through it. So firstly, what it says, like how it goes, is in the beginning of the chapter. So we have Atatho Bhagnanam Chikitsitam Vyakyasyamaha. So firstly, Acharya Sushruta, he starts with the contraindications as what are not supposed to be done with respect to the ahara and vihara that will cause, a problem in the process of fracture healing. Okay, so it starts like Alpashino Anatmavato Jantoho Vatatmakasya cha Upadravairva Jushtasya Bhagnam Kritrena Siddhyati. The next shloka says Lavanam Katukam Ksharam Amlam Maithunam Atapam Vyayayam cha na seveta bhagno rukshanam evacha. Okay, so these are the contraindications. Now, what is the rationale? What could be the rationale behind this? Is, as we know, as we go through the various chikitsa aspect of Bhagna, we see that Brahmana is the first line. It is a major line of treatment that we have to have. So Bhagna always goes with Brahmana Chikitsa. So that is why anything, either the ahara or the vihara, so whether it is the ahara or the vihara, which is a contraindicatory to this Brahmana karma, usually it is contraindicated for the Bhagna Atura. So what he says, Alpashino Anatmavato. So Anatmavata is what here, according to the Tika, he says is that it is Ajita Indriyasya Apatya Ratasya Ityartaha. So people who do not follow the proper Pathya, as we told, even in the Ahara also, Brahmana Ahara is mostly indicated in case of fracture. Okay, those Ahara Padarthas which are, which does Apatarpana is usually not indicated in the Bhagna Chikitsa. So all of these Nidanas like Alpashina, Anatmavata, Jantoho, Vatatmakasya cha. So those which are, especially in for people with Vata Prakriti, it is even more difficult. Okay, Upadraiva Jushtasya Bhagnam Kruchrena Siddhyati. So what do we mean by Upadrava? Now suppose we have a open fracture and Savrana Bhagna. So in case of Savrana Bhagna, in the Vrana, if if the infection manifests, then obviously we know that it is difficult for further management, right? So whatever could be the complication that arises along with the bhagna, whether it is immediate or late, in this context it should be an immediate complication, because we are dealing with the initial chikitsa aspect of the bhagna. So all that will be, it makes the process of fracture healing delayed. So the next thing what he says, what Acharya says, is that he implies on certain important rasas which are contraindicated during the bhagna chikitsa avadhi. They are the lavana, katuka, kshara, amla, rasa. Okay. Next is the maithunam, atapam, vyayamam cha na seveta bhagno rukshanam evacha. So here in case of the vihara, whether it is maithuna or atapa sevana or vyayama, so all of these again are langana karmas or the apatarpana kriyas which are contraindicated. So in case of vyayama or vyavaya, so obviously it could, the kriya itself could render much more displacements of the fracture. So even though you have brought the fracture to the alignment, because of vyavaya or vyayama, again the fracture could go, it could get undisplaced. So this is with respect to vihara, we can say that it is common. Now there is something Acharya Sushruta is focusing on, and that is on the, lavana katu amla rasa sevana, okay, and the kshara rasa sevana. So now I'm stressing a little bit on that, because it is direct that all these rasas, it could be just simply taken as it is contraindicated. But I'm going into a little bit of detail, because as students of Ayurveda, we need to understand that at least we must consider whatever is explained in our samhitas as the highest pramana. We need not interrogate or introspect into them. It is an aptavakya, and it always is a trikala satya. It is only for people who do not want to accept it in its way, or you want to go for another how it really happens. They go on for experimentations to bring back the same truth that is present in the Sushruta Samhita or any of the Ayurvedic texts again. So considering here, I would like to quote few lines from one of the major journals from the ResearchGate, wherein there are it is really astonishing to know what was the depth of knowledge our acharyas possessed back then, even without any sophisticated investigatory instrumentations. Okay, so it says that the ResearchGate, the article says that because of excessive salt consumption, it appears to be a risk factor because it increases bone fragility. So first thing I want to write with respect to the salt consumption. Okay, so the salt consumption, it says, so this is not from the ResearchGate, I would quote, this is another article. It says that it increases bone fragility. Right? Now, during the course of Bhagna Chikitsa, do we want bone fragility to happen, which is again an opposite mechanism for the healing process, right? Now, the next most important is that the article says that when there is high salt in your diet, then it induces hypercalciuria along with greater calcium excretion. Okay, so there is greater calcium excretion that happens in the body. Okay, and other thing, it says that it was an experiment that was conducted in a rat model, and what that experiment revealed is that in the rat model where it was being treated for fracture and given a higher diet with excess of salt consumption, then they saw that both the trabecular and the cortical bone architecture, okay, so we saw in the first class what were the different parts, like both the trabecular and the cortical bone integrity or the architecture itself. Okay, so they found that here there in both of these there was a decreased bone mass density, that the high salt consumption, it decreases the density in both, not only the cortical aspect, in the entire bone tissue, even at the trabecular bone tissue and even at the cortical, the outer part also, the BMD reduced. So this was what we have seen. Now this we saw with respect to salt consumption. Now suppose we take with respect to spicy food, what happens? Okay, so there is another study also says that excessive spicy food, okay, it increases the porosis of the bone. Okay, so see when Acharya has given to us as a sutra, So it is our prime duty to know it and follow it and just apply it, because we know that it is the ultimate truth. Fine. Now, suppose we want to, there are people who do not want to accept, or sometimes it is in a position where we have to prove to them. So these are all things. So I'm just emphasizing upon this just to make everybody understand and make sure that this was the depth of knowledge what our acharyas possessed. They not only possessed it at the level of only the macro level, they even had the minute micro level understanding of the body's physiology and the anatomy. So that is very important. So just to highlight that, I went a little in depth for this particular shloka. So that is why we have the Lavana, Katu and Kshara Dravyas, which are contraindicatory. Okay. Now we will move a little bit faster with respect to the other shlokas. So next, what is indicated? So in the next shloka, he says, Shalihi mamsarasaha kshiram sarpihi yoshaha satinajaha brahmanam cha annapanam syad deyam bhagnaya janata. So with this, we know that now it is importantly you have to go for brahmana annapana. So he's among them he quotes a few examples of Shali, Mamsara, Kshira, Piyusha. Okay, Tinaja is a Kalaya variety, a pea variety. So that is what is indicated. It's Indian pea basically. Okay, so next going on. And in the Tika also, Acharya Dalhana says that Brahmanam Deha Vriddhi Karakam. So that is why in this case, as we also discussed in one of the session, according to, not in this text, whereas I think according to Ashtanga Hridaya, wherein even, the Pishta Ahara is also one of the indications for the Bhagna Vyadhi or during the Bhagna Chikitsa. Okay. Next, after this, Acharya starts dealing with various materials we need to treat the Bhagna. So what is that? He says the Kusha. Why he is emphasizing on the kusha is for the bandhanartham. So we need to immobilize, like splintage, they were using these. So what are they? So he gives examples of Madhuka, Udumbara, Ashwatta Palasha, Kakubha Tvachaha, Vamsha Sarja Vatanamcha, Kushartham, Upasamharet. So here he says that so Bhagna Vrana Bandhana Dravyam Kusha. Okay. So wherever there is Bhagna or Sa Vrana Bhagna, for the Bandhana purpose, he is giving all these examples of these Vruksha, all the Panchavruksha Vargas. Okay. So the next thing what he comes is, next, suppose we cannot put only the Bandhana Dravya, right? So there has to be some amount of Alepa so that it acts on the Vrana. So for that what he says, Alepanartham Manjishtam Madhukam Raktachandanam Shatadauta Gruton Mishram Shali Pishtam Cha Samharet. So this is the different yogas or different options given by Acharya Sushruta as for Alepana Vidhi, what all we can use. Okay. So now we saw that. We saw what is the Ahara Vihara. We saw what has to be used for Bandhana Yoga, that is for the Kushartham. Okay. The next one we saw for the Alepana. Now comes, we have for Parisheka also. So for Parisheka also, again he is going for Shitala Dravya or the Shitala selection as for the Parisheka Karma. So he says, Nyagrodadi Kashayantu Sushitam Parishechane. Panchamoli Vipakvam tu Kshiram Kuryatsa Vedane. So this is what it is told. Again, Acharya in the coming shlokas, he says that when you're selecting, so you have to keep in mind the Kala and the Prakriti of the patient also. Okay. So this particular one, in the Pitta Prakriti Purusha and in the Pitta Kala. So in the further upcoming shlokas, we have examples of what to be done in the other Kala and the other Prakriti. So as of now, we are covering the main entities. So we finished with the Ahara Vihara, the Kusha for the Bandhana purpose. Then we saw the Alepa and the Parisheka. Now we have done the Bandhana. So when we have to remove or change the Bandhana, like one we have already seen in the Sutasthana, right? Like in which day has to be the Bandha removed after the Shastra Karma. So here it is with respect to the Bhagna Chikitsa. So what Acharya says is that Saptahat Ata Saptahat Saumyeshu Rutushu Bandhanam. Okay, the next line is Sadharaneshu Kartavyam Panchame Ahanihi. Agneyeshu Trahyat Kuryat Bhagna Dosha Vashenava. So suppose if it is in Saumya Rutu, you need to change the bandage 7 days once. In the Sadharana Rutu, it is for 5 days. And in Agneya Rutu, it has to be changed for every 3rd day. So this is with respect to the Bandhana Karma, the change of the bandage. Okay. So moving on to the next important shloka. Like in one of the session when we were dealing, I mentioned about Grishta Kshira, right? So here is the reference for that. So what is that? Grushta Kshiram Sa Sarpishkam Madhuraushada Saditham. Sheetalam Lakshaya Yuktam Pratha Bhagnam Piben Naraha. So see, this is such a this entire yoga is completely Brahmana Dravya fit. So what is Grishta Kshira? In the Tika, Acharya says it is Prathama Prasuta Go. So immediately that cow which has delivered for the first time, Prathama Prasuta. So that cow's milk is the Grishta Kshira. So that Grishta Kshira along with Sarpi. And again, you have to not just sarpi, you have to also make samskara to the same with the madhura aushadha dravyas. Along with that, he says, along with the laksha also. So all of these laksha, as we know, it is bandhana karaka. So along with all this, since it is very, very guru, so which is the kala he is prescribing, Acharya says, prataha bhagnam pibenaraha. So it has to be given in the early morning so that in the empty stomach, where the patient should not end up with ajirna, right? So it is given in the empty stomach in Pratah Kala, okay? Okay, the next, moving on to the reference for Savrana Bhagna. So what should be done for the treatment for Savrana Bhagna? Savrana Bhagna is what? It is nothing but a compound fracture. So next, after this, when we take up the management of open fractures, as we told, we will just see it briefly. There also the same thing is indicated, okay? What is it that Savranasya tu bhagnasya vranam sarpi madhuttaraihi pratisarya kashayaistu shesham bhagnavad acharye. So when we go through the commentary also, the first line of treatment in Savrana Bhagna is always to treat the vrana, and only Bhagna is to be treated next. So for that he says, what are the dravyas to be used, so that we can take it with respect to the Vrana Chikitsa Adhyaya, and what is that, what are the, the Kashaya Dravya, the Pratisarana Dravya, everything is being told. So for main thing here, what we need to understand is that in case of Savrana Bhagna, always make Chikitsa to the Vrana first, okay? So the next is, importance is, the last time we had seen, so which is the, healing time needed. So he says, Pratame Vayasi Tvevam Bhagnam Sukumaram Adishe Alpadoshasya Dantostu Kalecha Shishiratmake. So in all these, it is, it is suffice with Prathama Vayas. So he says that Prathame Ityadi Evam Iti Ukta Ahara Acharanena Ityartaha. Sukaram Sukasadhyam. So when everything, the treatment and Ahara Vihara, everything is same. So this is the with respect to 4 weeks or 1 month, it has to get cured. Okay, so next again he says that Pratame Vayasi Tvevam Masat Sandhihi. So here he says that what is the artha? Pratame Vayasi Tvevam Masat. Okay, Sandhihi Sthiro Bhavet. Madhyame Dvigunat Kala Uttare Trigunat Smritaha. So in Madhyama Kala, so or the Avastha, it is Dviguna. So it is 2 Masa and the next it is 3. Okay, now after this, he gives the main basic 2 treatment principles. So what is that? So these are important. Okay, again when we see the basic treatment principles, we will see it, what is it with respect to the modern treatment plans. So here he says, Anchanai Pidanaishchaiva Sankshepai Bandhanais Thata Sandhim Sharire Sarvamstu Chalani Api Achalanapi Etaistu Sthapanopayaihi Sthapaye Matiman Bishak. Okay, so this is what he says. So what are the 4 Sandhana Upaya Kriyas are? It is called as Bhagna Sandhana Upaya. So what are they? It is Anchana, Pidana, Sankshepa and Bandhana. So what is Anchana? So in the Tika he says, Samyak Shepaha Preranam. Okay. Okay, I am not able to find it. So basically what it means is that Anchana is nothing but traction. Now suppose consider this to be the shaft of the entire bone. Suppose there is a fracture here and the fracture is displaced like this. So what you have to do to bring it into anatomical reduction, first you have to perform a traction, right? Or you put certain amount of force to pull it back and to put it in proper anatomical alignment. Okay, so the next thing what he says is Pidana. So Pidana is what? So it is compression. So while handling or while we are reducing the fracture, certain maneuvers have to be done so that you you pull it, you change the position, you compress it a little, and then put into proper anatomical alignment. So that itself is pidana. Okay. So the next thing is Sankshepaihi bandhanais tata. So Sankshepa is putting it into the alignment. So it can be taken as the reduction. Next is the bandhana. So for the the bone to remain in the same state, bandhana is important so that the fractured fragments are immobilized. They are not allowed to move further. So for that you need bandhana. Okay, so this is what you have to do in the Tika. They say for even the Kanda Bhagna and even for the Sandhi Vishleshana also, this is the same protocol. These are the main 4 Bhagna Sandhana Upayas. This is told by Acharya Sushrita. Okay. Now moving on to the next important shlokas. So we have, yes, while we were dealing with, the treatment for dislocation of the hip joint. So then I had told you that there is one maneuver which I explained and told that this could be correlated with the chakra yoga that is told by Acharya Sushrita. So it is exactly the same. So previously, just to brush up, what is that we saw? What was the maneuver we saw previously was? So here in case what was it? So the patient is made to sleep, okay, and the hip is flexed so that the thigh and the ankles are at right angles. Okay, so this is the thigh and this is the leg. Now in that maneuver, what was done? It needed 2 people, right? Wherein one assistant, he put a pressure on the pelvic region and it was the pressure is exerted downwards, whereas the other physician, he catches hold of the leg and he exerts an axial pull, right? So because of that, what happens? Wherever is the sandhi, that is the head of the femur, comes and fixes into the cavity, which is evident by a sound. After which you can move the leg freely, and or the range of movements is to become sure of whether the head has been reduced or not. So you need to move the joint in whatever manner possible. So with that, if it is done properly, then it is assured that the head has been reduced, right? So we had seen that how we can see the treatment aspect for Kati Bhagna. Now when we go through, we can understand that chakra yoga is nothing but this maneuver. Okay, so what he says, Matimanch chakra yogena hi anchet urvasti nirgatam sputitam pichitam chapi bhatniya purvat bishat. Okay, so important thing what we have to see here is anchet urdhvam adhovapi katibhagnam tu manavam tatah sthanasthite sandau bastibhi samupacharet. So what is it? Anchet urdhvam adhovapi. So it is the same manner. So it is the same maneuver and the same therapeutic protocol for a closed reduction. So it is from the external. So it is a closed reduction. So this is nothing but the chakra yoga that is told by Acharya Sushrita. Okay. So the next important thing is, suppose in case of shoulder dislocation. So what he says, Acharya here is, Musalena udkshipet kaksham Amsa sandau visamhate sthanam sthitam cha badniya swastikena vichakshanaha. So musala is that instrument. Vonike they say. So with that, what Acharya says, so it has a round. I'm not getting the proper English word for that. So we have this round, the long metal substance which usually we use for pounding. In olden days, they used to use for pounding various grains or turmeric to process into a powder form. So with that, Acharya says that you need to, in case of shoulder dislocations, you need to use that at the level of the axilla, at the level of kaksha, to use that to put it into back to the anatomical place. So after that, we have to go for the swastika variety of bandha so that it is immobilized properly. Okay. The next thing what Acharya says, okay, as we move forward, okay, now we come for, there is something called as Kapata Shayana that is told by Acharya Sushrita. So this is nothing but, an internal fixation. Okay. So there is an exact name for this. I do not remember it now. Suppose maybe if I remember in the next class, I'll make a note on that. So for Kapata Shayana, what Acharya says is that Atha Janga Uru Bhagnanam Kapata Shayanam Hitam Kilaka Bandhanartam Cha Panchakarya Vijanata Yatha Na Chalanam Tasya Bhagnasya Kriyate Thata Sandehe Ubayato Dvau Talecha Ekascha Kilakaha. So usually what it is? So usually it is, now suppose this is the in Kati Bhagna, so Janga Pradesha. One second, sorry for the disturbance. Okay, so here, so what he says that Yatha na chalanam tasya bhagnasya kriyate tata. So what does this mean, that Yatha na chalanam? So this is nothing but the immobilization by internal fixation. Suppose you are not able to immobilize the fractured ends by an external reduction and external immobilization, then we have to go for an internal fixation with the screws. And we had seen, like for example, in the fracture of the shaft of the femur, we had seen this example, how it is fixed internally with the screws and DHS plates. So that is what it is, almost similar to that. So what he says that here this Kapata Shayana is nothing but it has kilakas, okay, wherein you are able to fix it. So how much is that? It has 5 kilakas, where it is. So suppose it is with respect to the Sandhi. Here he says in Janga and Uru Bhagna. Okay, this has to be done. Now what he says, if this is the Sandhi, Sandehe Ubayato Dvau. Okay, so suppose we can take it as this Talascha Ekascha Kilaka. So somewhere behind. So because of that, you are able to fix the fractured fragments still in that particular alignment. Okay, so this is about the that is Kapata Shayana. Now also that he says in the next shloka, Shronyam va Prushtavansheva Vakshasya Akshayostata. So even in the Bhagna of all of these bones also, we have to go for Kapata Shayana. Okay, so why it is needed that? Because of which you are not the part is not able to be given that freedom for free movement. So here we cannot completely say that it is internal fixation also, because here nowhere it is mentioned that it is going through the it is intervening through the body. So here it is almost like a cage wherein there is kilaka, and through which you have the limb is passed and it is held in position. So that is Kapata Shayana. Okay, so the next thing what is to be important here to be taken is yes. So here we have Kanda Bhagne Prarudhetu Vishama Ulbana Samhite. So this is the reference for malunion or non-union. So in such cases, what you have to do is Kanda Bhagne Prarudhetu Vishama Ulbana Samhite. So in such cases, Apotya Samayet Bhagnam Tato Bhagnavat Achare. So Apotya is to Vishlesha. So he says Vishleshana should be done. That is, you need to put back, it is almost like a case of refracturing and then putting the bone again into the same alignment. Okay, so that is the reference for malunion and aunion. Okay, now at the end he says that Bhagnam na eti yathapakam prayateta tatabhishat pakva mamsa sirasnayu taddi kruchrena siddhyati. So this is an indication that suppose in cases of compound fracture or in the when we see an example for when we saw the secondary type of osteomyelitis, usually where it happens because of an open in cases of compound fracture. So in such cases, obviously there is infection of the we saw the surrounding tissue or the wound itself. So in such cases, obviously the fracture healing goes to a delay. Okay, so that is what is being referred here. So at the end, what Acharya says is that Bhagdam Sandhim Anabigdam Ahinam Angam Anulbanam Sukha Cheshta Pracharanta Samhitam Samyak Adishe. So this is what he says, that is, there should be either no Sandhi, all the range of movements is able to be elicited. So there is no Hina or and Anga Anulbanata is not there. So with all these, it has come to the proper anatomical alignment, and all the range of movements with respect to that sandhi or that particular bone is able to be done. Then it is says, then he says that Samyak Adishet. Then the Bhagna Chikitsa has been done in a proper way. So now we have gone through only the basic important shlokas from the Bhagna Chikitsa. So I would request everybody to completely go through once of all the shlokas of Bhagna Chikitsa. We are doing it, I'm skipping main only few of them with respect to the time constraint. So with this, almost all the important parts of or the shlokas from the Bhagna Chikitsa is completed. Yes, we have another shloka that is with respect to the rehabilitation. So usually this one shloka is given with, in the Samhita, it is given with respect to the context of Talabhagna. But this can be applied to elsewhere also, fractures elsewhere also. So this comes to the picture of where rehabilitation phase of any fracture treatment. So what it is, Mrutpindam dharayet purvam lavanam cha tatap param. Haste jatabale chapi kuryat pashana dharanam. So here what Acharya says in context of the Talabhagna, that is either the fracture of the metacarpal, okay. In such cases, he says first to carry in the rehabilitative phase, once the fracture healing part has been, that a phase of time has been done. So then we have to go for rehabilitation. So in such cases, first we have to go for Lavana Dharana, next is the Mrutpinda, and next is the Pashana. So obviously we can see when compared to the weight of all these three, so we have the weight getting increasing. So with that, the muscle weight bearing capacity also increases. So that is how he gives an example of how you have to go about of exercises in cases of fracture in the rehabilitative phase. So this is an example given with respect to the Talabhagna, which we can incorporate to other Bhagnas also. Okay. So with this, now we will move on to the basics of treatment fracture principles. So these are treatment of fractures. So we have general principles. This is very important for us to know. So what it is? Okay. So usually it is split into two. Okay. So we have phase 1, 2 and 3. Okay. So phase 1 is the emergency care. Phase 2 we have definitive care. Okay, and in phase 3 we have the rehabilitation. Okay, so this is how usually any this is even for a closed or for a it is same for even closed fracture, and for open fracture certain protocols change, but right now consider the basic heading for both of them will remain the same, but what the contents are only will change with respect to the closed and open fracture. Now, the first thing if we are taking with respect to the emergency care, so this is split into two. Okay, so what it is, the first one is at the site of the accident and the emergency department. Okay. Now, majorly all of us have to know that what has to be done here. As doctors, it is more responsible for, we have to be more responsibly acting at that particular time. And we have to know what has to be done at the site of accident. Suppose we are not able to access at the emergency department, or, most of in common days, I know most of the compound fractures, they can, or many types of fractures are not being able to be managed at the normal smaller clinical setups, wherein we have to do the basic primary care, and then we are in a situation where we have to refer the patient to the further treatment aspects. So for that, first we have to know what should be done at the site of accident. So here, first thing what we have to do is the splintage. Okay, so this is very, very important. So this holds good even a common man need to know what it has to be done at the site of accident. So what it consists of is, the main rule is to right, to splint them wherever they lie. So this is the rule for splintage at the site of accident. So what you have to do, first of all, why you need to splint? What are the functions or the benefits of splinting? So the first thing is, so immediately when you splint, the pain reduces, okay, and it also decreases further displacement of the fractures, right? It decreases further displacement. And the next is, it prevents complications. What complications? Like, for example, fat embolism, okay, fat embolism, or it could also be like, when you're splinting it, it is almost like you're trying to even arrest some amount of bleeding if it is occurring at that place. So you're also preventing, bleeding. So these are certain complications that could occur with respect to a compound fracture. So here, by splinting, these are the benefits what we are coming across. Now the next thing what we are seeing is, now how it has to be splinted at the site of accident. So at the site of accident, it is a rule that whatever thing we get, we can splint the fractures with that. Like, for example, if you have an umbrella at the site of accident, if you have a thick paper roll at the site of accident, you have a cardboard piece, that also can be used. You have a small wooden stick, that also can be used. So all of these can be used for splinting. Even a pillow could be used for splinting. So that is the first rule, that at the site of accident, the splintage should be done. And you have to note that time should not be too tight. Okay. While discussing the Chikitsa Sthana now, I just forgot to mention of which is the type of bandha that is to be done in case of fracture. So even Acharya Sushruta says that in bandha, it is always the Sadharana bandha that we have to do, and not the Gada bandha or the Shitila bandha. Okay. So even here also we have to see that a very tight splintage must not be done, so that it hampers the circulation. Okay. Now after this, now comes the scene at the emergency department. So what is that we have to do when person has arrived with this basic care at the site of accident, and now he has come to the emergency department. So here first is that the first rule is to go for basic life support. Okay, so this is the first thing. Now next, what we are supposed to do after BLS. Now suppose if the patient is in shock, always you have to revive him from shock, and only then you have to proceed with any other orthopedic treatment. Okay, so this comes first, and any definitive care always comes next. So first is always to revive the patient. Only when the patient is stable enough to live can you treat the fracture, right? So always in cases of compound fracture or in cases of RTA, the first line of treatment is to bring back the patient into the so that all his basic life supports are in place and his basic vitals are also stable. So that is the first thing what we have to do. Now, and the next thing is, after this you have to make a quick evaluation of the injury. You have to go for quick evaluation of the injury. Okay, and suppose if there is bleeding, you have to look for measures to arrest the bleeding, so that the patient will not end up with hypovolumic shock. Okay, now after this, what is the next is, so since we have, while doing the evaluation, you have to also go for a neurovascular assessment. So suppose if any nerve is injured, if any major vessel is injured, all that has to be assessed and noted down. All these has to be done very, very quickly. So all of these are not a detailed examination procedure. So this is done very quickly with respect to the condition of the patient. Okay. So the next thing what we have to do is, after this, usually they go for a better splintage is done. So first, at the site of accident, whatever materials we got so that we could support the fracture, we splinted it with that. So, but in the emergency care, the splintage differs with a little bit definitive one. Okay. So what are those? So we have something called as Thompson's splint. Okay. So after that we have Kramer wire splint. So here it is usually like surface like this. Consider it to be like this so that you can keep it here in splint, and here it will have wires. Okay, so this is a Thomas splint. I'm sorry, it is Thomas splint. Okay, so with Thomas splint is also similar. So it has something. It goes something like this. Okay, so this is the Thomas splint. This is the Kramer wire splint. And the third one, you have also splints that are inflatable. So what is that? Once you can move the limb through that, and after that you inflate the material so that it's like a balloon where inside is the limb and outside is the inflated structure, so that it is also splinting and it is also giving some amount of protection. Okay, so these are the varied types of splintage that is done at the emergency level. Now, so we have completed the phase 1 of the treatment. Now we are left with phase 2 and phase 3. So now comes the definitive care. That is phase 2 of fracture management. So here what we do is, first thing is that, so usually here it is an anatomical reduction is done. So one thing what we have to keep in mind is, usually before, fracture union was supposed to be the ultimate aim of fracture treatment. Okay, earlier fracture union was considered to be the same, but now it is not so. But now it comes to what is the mainstay of any fracture treatment is the rehabilitation of the limb as it was like prior to the injury. So this is the mainstay of treatment. So even though at the end of, they say the rule is that even though some amount of anatomical alignment is not correct, but the limb gains complete rehabilitation, it is still a good treatment for fracture. Okay, so earlier fracture union was the main aim. Now it is the rehabilitation of the limb. So in this case is what they do is that, so first thing what we say is that it is the reduction. So for reduction we have two types. Reduction is of two types. This is a very lengthy chapter. I'm just trying to concise and put it in brief. So you have open reduction and closed reduction. Okay, so usually closed reduction is the one which usually is done for in cases of a simple fracture. So usually it is not done in cases of compound fracture, but texts also say that if you are able to go for a closed reduction, it is okay. So only in cases where where you are depicting a more amount of neurovascular injury, then they go for an open reduction. Okay, so open reduction is what? In closed reduction, like we saw, the Bhagna-Session upayas. So Anchana, Pidana, Sankshepa, all that is done. So a little bit of traction, a little bit of, change maneuvers are done. Like we saw the one for hip joint, and it is tried to bring back to the anatomical alignment. So that is closed reduction. In open reduction, when that is not possible, you cut open at the site of, the fracture, and then with the help of instruments, you try to bring back the, both the fractured ends into same anatomical alignment. So that is called as reduction. Now after reduction, what is it? Does definitive care ends there? No, right? After reduction, what we have to do is, you have to go for immobilization. If immobilization is not there, is not done, then the fracture ends could again displace and it could go back to the same thing. So in definitive care, first one is reduction. Second thing what we have to go for is immobilization. So in immobilization also, so we have the common methods. So that is called as the conservative methods. Okay, so what are these? Like we know we have POP, we have strapping. Like in cases of, strapping is done for fingers usually. So we have strapping, we have POP, we have slings, okay? Like we saw in case of shoulder joint dislocation, right? So we have triangular sling. So these are slings. So usually POP is an example for cast immobilization. So we have many under this. So under cast immobilization, usually done is the POP. So these are all conservative methods. Okay, what is usually done. Now suppose if all of these are not able, fail, then we have to go for the further ones. So what is that? It is nothing but the operative methods. So like we saw in fracture femur, operative methods. So what do you use to immobilize? Like I said, you open and you reduce. Once you reduce, the bone has to be in the same anatomical alignment. So suppose in an open reduction case, so usually you have to go for an internal fixation only, that is internal immobilization only. So how it is done? So they use plates, okay? They use screws. We have they use K wire. So this K wire is almost, it's a steel wire, especially in cases of in the foot, in the small bones, when for example metatarsals, when fractures happen there, K wires are used even for the fingers. So in such cases, they go for the operative methods of immobilization. Okay. So there are many such are there to name. These are the basics ones that we have to know. How we have to reduce in case of an operative method. How we have to immobilize. Okay. Now we have completed phase 2. So phase 3 is what? Rehabilitation. So phase 3 is rehabilitation. So what comes here is, the main thing is the exercises. Okay, so this forms the mainstay of rehabilitation. So here it is again, during immobilization and after immobilization. And after immobilization. So during immobilization, what it is? Suppose there is a fracture here. So, this entire thing is put into the cast. Now, suppose this joint is out and this joint is out. Okay, so whichever is the joint, which is outside the cast, always you need to move it so that you don't put the joint into stiffness. And they also say that if possible, you also need to function on the muscles which are inside the cast. Like if you are able to contract and release it, so that the muscle function don't go down. So that is the importance of exercise during immobilization. Now next comes after immobilization. So here totally it is to avoid weakness of muscles. Okay, avoid weakness of muscles and the joint stiffness during immobilization. Now, after immobilization, what we have to do is that, so for some time, whenever a joint is or any part of the body is maintained in the state of immobilized state, obviously the first thing what we get is stiffness, right? So to avoid that, we have to go for exercises post immobilizations. Okay, so so physiotherapy is advised. So there is varied amount of exercises with respect to the fracture. So this is what I said, what we saw in cases of Talabhagna, that first the Lavana, next the Mritpinda, and next the Pashana Dharana. It is nothing but this, the post immobilization exercises that is explained by Acharya Sushruta. So this is with respect to phase 3 of closed fracture. Everything remains the same, but for an open fracture, the first thing what we need to be, okay, in open fracture, so Savarana Bhagna we dealt with today in the, Samhita. So even in case of open fracture, two main important thing what we have to look for is, one is wound care, and the next is, suppose in case of, open wound, we have to look for features of shock or, blood loss. Okay, these both becomes an important mainstay. So here also at the site of accident, always whoever it is, even a layman, he should look for to arrest the bleeding with any clean material, cloth material he has, so that has to be tied around. Okay, like for example a very clean kerchief or a clean any cloth in that face. So at the site of accident, this has to be done to arrest the bleeding. So in the emergency where in the emergency department, so what is first done? First is done the wound care. So it is given the thorough wash so that no infections can happen in the wound. So the proper wound care is done. Then arresting of the bleeding is done. Emergency, what are the other? So you have to go for a tetanus prophylaxis, right? So tetanus prophylaxis is given. After that, as we saw previously, a definitive splintage is done. Okay, and antibiotic regimen is done. Antibiotic regimen is taken. So all of this is done at the emergency care, and it is also very important that we have to include analgesics also. Okay, so here in this care, after this, then we move to the stage 2, that is definitive care. Here it is important that in open fracture, in phase 2, that is definitive care, here also they suggest that first you have to go for wound management. Only then you have to go for fractured management. So it says that it goes with wound debridement or whatever necessary things to be done for wound management and wound closure, that is done. So only when the wound heals, only later we have to go for a orthopedic intervention, that is the fractured management. Okay, so after this it is the rehabilitation again. So rehabilitation has no much difference with respect to open or closed fracture. It is the same. So with this, we have come to an end of the sessions on Bhagna. So today, as we rushed through the basics of basic principle treatment for fracture. So it is seen in 3 phases: phase 1, phase 2, and phase 3. Phase 1 is emergency management, phase 2 is definitive care, and phase 3 is the rehabilitation. So it is same for almost all fractures, but for compound fracture in emergency care, it is important for us to have good wound care and also to arrest the bleeding. Otherwise, the splintage, immobilization, reduction, everything will be the same. Rehabilitation is also the same. In case of open fractures, always importance is given to wound care, and next is importance to the orthopedic intervention. Okay, so we also dealt with important shlokas from the Chikitsa Sthana of the Sushruta. So with this, we have fairly completed all the aspects that is needed for under the context of musculoskeletal injuries or under fracture and dislocations. In the coming sessions, we will start up with the next system or the next organ, so that we will see what can be taken up in the next session. So with this, I would like to end today's session again with a small prayer. Om Gnananandamayam Devam Nirmalaspatikakritim Adharam Sarva Vidyanam Hayagrivam Upasmahe. Om Shanti Shanti Shanti. Shubha Madhyana. Have a good day ahead. Thank you.